Hello everyone, I am Dr. Dutta. I am an endocrinologist based at the Seda Super Specialty Clinic in Dwarka, New Delhi. Today we are here to discuss a very interesting real life scenario which would make it really easy for us to go for diabetes reversal in our patients in our simple clinic. Well, the diabetes reversal is a concept, the in thing of this decade. Now we know that people with type 2 diabetes, especially those who are obese to overweight, if they lose the excess body weight, we can actually reverse diabetes, which means the person continues to have an HbA1c of less than 6 or 6.5%, and he is off all diabetes medication. An extension of diabetes reversal is that people who have a high medicine burden, they can reduce their medicine burden, be it insulin or tablets, by nearly 70 to 80%. Now, sitting here in Delhi, at the prevalence of obesity by the Asian Indian cutoffs among adults in Delhi is around 60 to 70%. And the urban prevalence of diabetes is very, very high as compared to the national prevalence of around 10%. So let's start with Mr. Anil. He is a 40-year-old gentleman who has had diabetes for last 4 years. He works in the corporate sector, hectic schedules. He has to fly frequently. Of course, the COVID pandemic did reduce his travel, but now it is again going up again. He has to eat out, and he has a HbA1c of 8.3%. If you see his clinical and biochemical parameters, he has metabolic syndrome. That's very common. He has a high triglyceride of 250 milligrams per deciliter. He has a low HDL of only 35 milligrams per deciliter. He's already on full dose of metformin. He's on a statin, and he's on an antihypertensive medication. He is on telmisartan 40 milligrams. So for him, now the most critical thing is BMI is 32 kilograms per meter square. We know for Asian and the Indians, the cutoffs are you'd love to keep a BMI less than 23. In simple rules, if my height is whatever is my height is in centimeters, if I remove 100 from it, is the upper limit of my ideal body weight. So if my height is 170 centimeters, my ideal weight would be 70 kilos. For Mr. Anil here, he's a tall person, his height is 180 centimeters, but he currently weighs 102 kilograms. So this is important. These patients are not uncommon in our clinical practice. We need to tell him if you can reach your ideal body weight of around 80 kilos from 102, there's a very, very strong chance that you are going to go off the diabetes medications. So how do we go about doing it? I think a good therapeutic diet and lifestyle is very important. We all know that we need to take low carb diet, increase the proteins, exercise more, walk at least 10 to 12,000 steps a day. But the big challenge is the motivation. How can we motivate ourselves? How can we motivate our patients? I think in this regards, medications like SGLT2 inhibitors and flag bearers like empagliflozin have a major role to play. Along with it, DPP4 inhibitors are like the win-win situation. When you combine an SGLT2 inhibitor with a DPP4 inhibitor, you have synergistic impact on blood glucose control. The weight loss properties continues to be maintained without any risk, increased risk of hypoglycemia. The key word is increased risk, because if you keep these agents aside, you compare with sulfonylureas or insulins, they all are linked with increased risk of hypo because their insulin secreta bogs, and even subclinical hypos can make the patient eat more. There is compensatory overeating, fearful overeating, which further leads to weight gain. So, weight gain remains a challenge with most of the second line anti diabetes medications. A fixed dose combination of empagliflozin and linagliptin reduces the pill count. Just one tablet has a very good glycemic efficacy ranging from 1 to 1.6%, even 1.8% higher the baseline HbA1c, greater with the glycemic efficacy. So in our patient, Mr. Anil, who was on metformin 2 grams per day, nearly full dose of metformin, he needs an agent to motivate him to go for therapeutic diet and lifestyle change. So a fixed dose combination like Empalina really make a lot of difference. Would keep his pill count to minimum, just adding one more tablet. His current HbA1c is 8.3. He has a very, very high likelihood that he will reach the HbA1c target of less than 7 or even 6.5 without causing hypoglycemia. And the most important, patients say, Doctor, whatever I try, don't lose weight. I'm trying. So they're not motivated. This is a medication which is going to give some initial amount of boost and initial amount of weight loss. A weight loss of 3 to 4 kilos is very common with SGLT2 inhibitors. that would, if the patient sees a positive result, he will enter a positive cycle of self motivation. He would walk more, he would have more motivated to control his diet, cut down on carbs, take a lighter dinner. So, this combination of patient centric medication therapy, which really tackles the problem of diabetes, handling the issue of dysglycemia most potently by a single medication, giving the pleiotropic benefits of weight loss, often leading to a reduction in need for other anti-hypertensive medication or anti-lipid medication. I think this is the way forward. This is the ideal way of managing diabetes in 21st century. So, Mr. Anil, I'm sharing a real patient. After 4 months of use, he attained an HbA1c of 6.2. I ended up reducing his medications by 50%. And during this period, coming down from 8.3% to 6.2% HbA1c, he did not experience a single episode of hypoglycemia. He lost nearly 8 kilos of body weight. From 102, he came down to 94 kilograms, and he could see the results. We were able to stop his statins. We were able to stop telmisartan 40 milligrams because he was maintaining a blood pressure of 110 by 70 millimeters of mercury. So when we talk of diabetes reversal, at the same breath, we should also discuss about hypertension reversal and dyslipidemia reversal, because the three together constitute the main component of metabolic syndrome. And we address the main issue of metabolic syndrome, which is excess body weight. If we lose that, we can have triple reversal of diabetes, hypertension, and dyslipidemia. And he was so motivated, he couldn't believe it. And I told him, now your mission is to go around to your neighbors, your family members, tell them about the concept of diabetes reversal. So no fancy diets are needed. People can try keto diet or paleo diet. They may try for a few days to weeks. They are boring. A simple, low calorie, low carbohydrate, balanced, high protein diet with at least 12,000 steps per day, and going for patient centric pharmacotherapy, where we keep the tablet count, pill count to as less as possible, which will improve the compliance, and use medications which are known to cause weight loss, like optimal dose of metformin, optimal dose of SGLT2 inhibitor like empagliflozin in our patient, and the optimal dose of DPP4 inhibitors like linagliptin here in a single tablet, which is known to have a good glycemic efficacy with being weight neutral. So this was not the end of the story. I'm sure he'll come back to me after 3 to 4 months again, and I'm sure I will be able to totally stop his medications. I wanted to share this with all my dear and esteemed colleagues. So it's very easy to go forward with diabetes reversal in a simple clinics. You don't need any fancy gadgets. Wishing you all a lot of good health. Take care. Namaste.